Alrighty, good afternoon, everyone. We hope you've been enjoying the sunny weekend so far and are staying safe. My name is Katrina Langsavath. I'm a first-year student at CMU, and I'm president of the Project Pulse Winnipeg executive team this year. Project Pulse is a student-organized nonprofit organization whose goal is to familiarize high school and post-secondary students with the field of health sciences through an annual conference. Unfortunately, the 2020 conference scheduled for this past spring was canceled, but thankfully the organization is navigating an online platform in these pandemic times in order to bring you events, resources, and opportunities for health sciences education. All of the executive team roles are filled with passionate and hardworking students from diverse cultural and academic communities in Winnipeg. They're in the audience, so maybe give us a quick wave, guys. Thanks. All of these roles contribute significantly to Project Pulse Winnipeg in unique ways and helped to plan this professional school university panel. Today, our University Relations Director, Alicia, will be hosting this event. On behalf of the team, I'd like to extend a warm welcome to our audience, which consists of 60 high school and post-secondary students from all over the province. We encourage everyone to have their cameras on for the best experience of engaging with the professional panelists, but this is not a requirement. Please note that this event will be recorded and that the recording will be posted on Project Pulse Winnipeg's online platforms. This includes social media and our website. Please fill out and return the waiver attached to the email you received this morning to confirm your consent to be recorded and posted as a part of this video. If we do not have your permission to feature you in the video, you do not need to have your camera on and are perfectly welcome to engage through the chat function instead. Without further ado, I will hand this off to Isha to introduce herself and today's distinguished guests.
Thank you for that, Katrina. So hi, my name is Isha and I'm the University Relations Director for this year's Project Pulse online team. So we're going to start this panel by doing the individual discussions, and I'm just going to briefly introduce the panelists before that. So our first speaker will be Simranpreet, and Simranpreet is a first-year pharmacy student at the University of Manitoba who recently graduated with a Bachelor of Science degree with a major in biochemistry. Our second panelist is Alicia, and Alicia is a second-year nursing student at the University of Manitoba, and she hopes to one day become a pediatric nurse and later work in the neonatal intensive care unit. And then our final panelist for today is going to be Matthew, and he is in his third year of medicine at the Max Rady College of Medicine. He completed his undergraduate studies at the University of Manitoba, where he also majored in biochemistry. So with all that said, I'm going to invite Simranpreet to start his discussion.
Hi, everyone. Hoping you're having a good day so far. So I'm a first-year pharmacy student. It's a PharmD program now, and I graduated recently from the University of Manitoba with the biochem degree. So far, my studies have been very challenging, I have to admit. It's a very tough program. It's also tough to get into, and also just keeping yourself in it as well. It requires a lot of work, but so far I'm enjoying it as well. I know that majority of my classes are online, so I'm not able to have enough contact with my classmates, but we're trying our best to, work around that. But I was fortunate that there were few labs and few courses that I could go to university and could participate in those. And one of the ones that I did participate in is a compounding lab. So as a pharmacist, we also prepare and dispense medication. So that was one of the things that we were able to learn this semester. Anything else about the my experiences in the past is I have been involved in a lot of different things throughout university, even before university, in high school as well. I went to Maples Collegiate for my high school. There I was part of a lot of clubs. I was part of Asian Heritage Club. I was part of the Science Club. And then in the university, in my second year, I started as a peer mentor for first year students. And then at the same time, I was volunteering at Health Sciences Center as well. I volunteered there for about 4.5 years. Starting off with the gift shop and then moving on to Children's Hospital, where I volunteered as a ward visitor. And then currently I am part of the advocacy committee for CAPC, which is one of the organizations for pharmacy students. And then I'm also a representative of the Social Accountability Committee of Rady Faculty of Health Sciences, where we're working towards issues that involved inequality, looking into minorities and what issues they have and all of that. I'm part of that. And overall experience so far has been a bit different because obviously it was my first year. I wanted to be at the university majority of the time, but it's not like that, but it's fine because I think we as humans, we always want to adapt to new things, and technology is something that is becoming the top, it's a talk of the town all the time. It's always, we're using it all the time now, and we're learning new things with it. So in that manner, it's fine, but I'm hoping things things become normal again. I would be able to, attend all my lectures in person. I think that's it from me. Thank you.
Okay, thank you so much, Simranpreet. We'll move into our second speaker, which is Alicia.
Hi, everyone. My name's Alicia. I'm a second-year nursing student at the University of Manitoba. I graduated high school in 2016 from St. Mary's. So I've been in university for a long time now. So I'd be happy to answer any questions you guys have later on about university. I actually started off by going to U of W, which was a completely different experience from U of M right now. For me, I would encourage, like, if you're interested in health sciences, you're interested in doing like a biochem degree or like a biopsych degree, I definitely preferred U of W more because the class sizes were so much smaller and you kind of get like a high school feel, because it's super scary to like go from high school to university because it's new people, it's a new environment. And I just loved U of W so much because the teachers were like so helpful. They were able to give you that one-on-one interaction that you have in high school. And when I went to U of M to do some of my prereq courses for nursing, I like kind of missed out on that. So I definitely think people should consider going to U of W for health sciences before you apply to a professional program, because it's honestly great. Even the lab sizes are so much smaller than that at U of M. Because I did chemistry and physics in UW before I decided I wanted to do nursing, because I had a couple options in mind before. I was thinking about doing occupational therapy, dentistry, or nursing. So I kind of took a lot of courses the first couple of years of university to try to figure out what I wanted to do, but I ended up really liking nursing. So I've been volunteering at St. Amant. I volunteered with Cancer Care Manitoba, and I volunteered at various hospitals. I did like HSC, and after volunteering at HSC in the pediatrics unit, I fell in love with nursing. Like, I just got to see that one-on-one interaction that nurses had with the patients there. And I just like knew then that I just wanted to do nursing. For nursing, you don't need to write an exam for your entrance, and there's no interview, which is like so much better because it takes off that massive stress off your head. All you need to do is a year of prereq courses. I believe there's a microbiology course you need to take, and anatomy and physiology. And then there's some other electives that you can find on the University of Manitoba website. But it basically takes about a year and a half to do. And then you apply to nursing, and they consider your AGPA. So the 3 core courses are microbiome, anatomy, and physiology, and that's 30% of your AGPA, and your electives are worth 70%. And I think when I got in, the competitive was 3.8. So I think that's like a B or B plus average. So it's not too bad to get into. Other than that, to talk a little about nursing, right now I've got to experience being on a subacute unit. So it's kind of like a medicine unit, and we get to administer medication. We get to do wound care right now. That's our main focus this semester. And I really enjoyed doing that because I got to see, like I was at Victoria Hospital and I got to see how important it is that like for medicine, for nursing, for pharmacists, like everyone works together in the healthcare team. So in order to like be a healthcare professional, like you have to know how to work in a team and how to work together because that's so important. Like the amount of times like me as a student, I had to communicate with so many doctors and pharmacists, and you just realize how important each and every single role is in the healthcare system. Um, so a little bit about nurses, like they're responsible for advocating for patient safety, patient health. We're responsible for monitoring symptoms. For example, post-surgery, we're looking after patients. We're looking after people who have all kinds of problems and we're referring them to doctors. So it's really important for doctors and nurses to work together because doctors aren't always there. So if you enjoy having like a one-on-one relationship with patients, I think nursing is definitely a great job, like a job for you because you're just always with a patient. You get to know them on a more emotional level and they just appreciate you so much for everything that you do. I know there's been a few times where I myself have gotten emotional because I've gotten so attached to patients. And I know like in nursing, they're just like, don't get attached because you have to like have boundaries, but it's so hard because they just respect everything you do and like all the care you do for them. And so if you enjoy that kind of bond with patients, I definitely recommend considering nursing. It's really great. It's a really great experience. And I think it's a really rewarding job as well. Not only like are you helping others, but I feel like you get such a mental satisfaction out of doing it. It's really great. And the only thing I would say is for any university program you do, I would say take your time. Don't rush into anything. When I first went into university, I thought it was going to be a piece of cake. I was like, oh, I'm going to take 5 courses. I'm going to finish my undergrad in like 2 years. I'm going to do this. I'm going to do that. And then I went and I'm like, oh my gosh, this is like completely new. It was like a shock for me because all my friends went to U of M and I went to UW, so I didn't know anyone. So I had to like basically start from the bottom and like make new friends and like learn about university because I was kind of the first one in my family that experienced university. So I was kind of like the test baby. So I had to like start from the bottom and know what works for me. And honestly, like having a schedule, being organized, it really helps. Although I am a procrastinator, but being organized really helps, making a schedule of like delegating study time. And I know a lot of university students work too. So just incorporating all that in one day or throughout the week, like just make sure you have a schedule and that you stick to the schedule because it's really going to help you long term. Because university is all about independent studying. So you really have to make it up to yourself and don't feel like you have a timeline because I know a lot of kids rush into university thinking that I don't want to waste time, I don't want to be old and study, but honestly, like take your time because your GPA matters so much when you're applying to programs. So if you like for your first semester, you want to try it out, take 3 courses, see how you feel. Then if later on you feel like you're comfortable with it, take more, take 4, take 5, whatever you feel comfortable with. But don't be afraid to drop classes or to ask for help. Like we have great advisors on campus at U of W and U of M. And if you are like considering nursing, we have nursing, the Faculty of Nursing has its own advisors and they're doing Zoom meetings right now because of COVID, but they can give you great advice of like what they're looking for, what kind of things to expect and what kind of courses to take. So definitely use your resources that you have. Like reach out to any cousins or any of us who have university experience because it'll really help you. Like you feel like you won't go blindsided into something. But yeah, other than that, if you guys have any questions later on, feel free to ask any of us. Yeah.
Thank you so much for your discussion, Alicia. We're going to move into our third panelist, which is Matthew. So feel free to start.
Hi, everyone. Thanks so much for having me. So my name's Matthew. I'm in my third year of medical school here in Manitoba. So to start off, I'll quickly go through my path. So I graduated high school in 2014. I went straight to the U of M and I did a 4-year biochemistry degree. I wrote my MCAT, which is the test you have to write to apply to medical school. So I wrote that between 3rd and 4th year of my undergraduate studies. And then I started med school here in 2018. So that brings me just a few months into my 3rd year of school. So I'm going to quickly talk about a little bit about what medical school is like and what you can kind of expect to see if it's something you might be interested in. So it's a 4-year program. The first 2 years are all classroom learning. There's a big group of you. There's like 100 people in your class. And basically from 9 to 5, you just attend lectures and lots of lectures a day. It's usually like maybe 6 hours of lectures a day. And you spend your free time and your evenings studying. Other fun things you get to do in the first 2 years are anatomy labs. So you learn all about anatomy, and then you get to go to the lab and you get to actually see it in real people and the cadavers there, people who donated their bodies for us to learn from. So that was really cool to see, to experience that. Other things you get to do in the first 2 years, you get practice interviewing standardized patients. You do a lot of physical exam skills, like learning how to physically assess patients. And the great thing about med school is that it's predominantly pass-fail. So it's not super competitive. You're not like competing with your peers. So it creates a really awesome, collaborative, friendly environment. Since you spend so much time with everyone, you make really good lifelong friends. And you're all going through it together and you get to hang out with your friends. And at least before COVID, you get to like go out and celebrate after exams. And it's a lot of fun. It's not just studying. It's also like a really good bonding experience with your colleagues. So moving on to Med 3 and Med 4, that's where I'm at right now. So in Med 3 and Med 4, you start working in hospitals and you start working in clinics and you become a part of the healthcare team. So some things I do is I'm able to independently see patients. So I'll say I'm in emergency or something, I'll go see a patient, I'll take their history, figure out what's going on, do a physical exam, try and come up with a plan, try and figure out why they're sick. And then I present this patient to my supervisor, my attending doctor. And then in collaboration with other healthcare workers, we come up with a plan for the patient and try our best to help them. So years 3 and years 4 is basically like learning on the job. They just throw you in with the knowledge you learned in the first 2 years and you try your best to be a good contributing member of the team and help see patients and things. So I'm going to talk about a little bit why I really love medicine so much and why I think it's such a fantastic option. So one thing I really love about it is just the problem solving aspect of it. So if you really enjoy like logical things or doing puzzles or applying your knowledge to solve problems, that's one of the most fun aspects of medicine. So for example, if a patient comes in with a headache, there are like 20 different causes of a headache. There are some super benign, harmless causes where you can just reassure the patient and give them some Tylenol. Or there are some really life-threatening causes of headaches, like strokes or infections or things like that. So the patient comes in with a headache and you have to use your problem-solving skills to take their history, do a physical exam, order labs and order imaging, and use all the knowledge you've gained in the first few years to figure out what's going on and hopefully help them. That's one thing that's really fun, is applying all the knowledge you've learned and helping people like that. Another reason why medicine is such an awesome career and so fulfilling is because you get to work with patients and you get to see people at their very best and in the happiest moments of their lives. And you get to see people at the absolute worst moments of their lives when they're the most vulnerable. And that's something that's really exclusive to the medical field. And it's really a privilege. People put so much of their trust and their faith in you. And it's really gratifying work. So some examples of that is I was working on the pediatric oncology unit. So that's kids that have cancer. So during my time there, working with my attending doctor, we diagnosed a 6-month-old boy with a rare type of blood cancer. So it was me, the doctor, and the mom holding her baby. The dad was there over FaceTime because of COVID. You're only allowed one visitor in at a time. So he was listening into the conversation. And we spent over an hour giving the diagnosis and following up and answering all the thousands of questions this mom has about, is her little baby going to be okay? What treatment can we offer? What can we do for this baby? And we spent all this time just sitting there and talking in what was probably this woman's, probably the worst day of her life. And being able to provide that reassurance and being able to come up with a plan of how we're going to help this little boy is extremely gratifying. And it really makes all the hours you put into studying and training to get there, it really makes it worth it, being able to help someone like that. And on the other side of the spectrum, you also have extremely happy moments, and you get to be a part of some of the best moments of people's lives. So one example of that is when I was working on the obstetrics ward. So that's when moms who are pregnant, they come in during labor and they go to the labor and delivery floor and they deliver their babies. And since people don't decide when they go into labor, this labor and delivery ward is very active at all hours of the day, morning or night. People are coming in delivering babies. So I was working a 24-hour shift on this ward, and it was 1 a.m. So I was maybe 16 hours into my shift, and I was tired and I hadn't slept yet. And I get called to one of the patient's rooms, and the doctor I was working with met me there. And so him and I both gown up. We put our PPE on. We put our gloves and everything on. And we go to the mother's bedside, who's very close to delivering. So we have a look. We look down at the mother's pelvic region. We can see the opening, and we can see the baby's head popping out. Baby's head's really big. Baby's head's probably the biggest part of the baby. So once the baby's head comes out of the mother, after that it's like butter. The baby just slides out. So normally as a medical student, on labor and delivery, it's more so just observing and helping where you can. But this doctor was really nice, and he actually let me deliver my first baby. And that was actually one of the best moments of medical school for me. The baby's head came out, the rest of the baby slipped out super quickly. This little human being that had been growing for 9 months in the mother's belly, all wet and soggy, and you take the baby and you throw it on the mom's chest, and you get to see the mom meet her baby for the first time, see her healthy baby. You get to see the dad cut the umbilical cord, and it was probably one of the happiest moments of their life. And I think it's such a privilege for me to get to share that moment with these people. And that was another one of the moments that really, that made all the studying and all the hard work worth it, was getting to be involved with things like that. So there are a lot of really awesome things you get to do in medicine, and a lot of really great reasons to love the profession. So I'll quickly talk about, before I finish, I'll talk about some reasons why you might want to pursue medicine. If you love working with people and you love being there for people and you have good interpersonal skills, then this might be a good career option for you. like I said, you are working with people when they're at their most vulnerable. You are doing very intimate physical exams. You're the only one that ever does these things to these people, and it's super intimate. And if you like working with people and reassuring them when they're sick and being there to help them, then healthcare is a really great field for you. If you enjoy learning and you're self-motivated, then I also suggest working in healthcare or medicine. I genuinely really love learning these things, and it would be really hard to make it through all these years if you didn't enjoy it. My next exam isn't for 3 months, and yet, I spend my time studying because it's not just about passing exams, it's about learning information that's going to be helping your patients one day. So you have to be super self-motivated in that sense. And if you want to go into healthcare or if you want to go into medicine, I'm sure my colleagues can attest to this, but you have to be willing to get out of your comfort zone and push your boundaries. You leave the safe setting of a university and the very safe classroom where all you do is, read and learn things from textbooks, and you enter the real world. And on your first day, you're thrown into things, and just like that, you're seeing patients and you're doing procedures and you're doing very intimate exams, and you got to be willing to just dive right in and not flinch and be able to do all these really cool, awesome things and really get out of your comfort zone, because I am uncomfortable so much and I'm always like, there's a lot of stress involved, and you just gotta accept that and accept that a lot of things are out of your control. And you really got to be willing to grasp this uncertainty and not knowing what a certain day is going to hold. So it's a little bit stressful sometimes, but at the end of the day, it's going to make you a really great healthcare professional or a really great doctor. So those are some reasons that if you sound like some of these things resonate with you, medicine might be a really great field. So that's all I have. Thank you.
Okay, thank you so much, Matthew, and to Alicia and Simranpreet. That was really great. So now that we're done with the discussion, we're going to move into the questioning period. So